Are you able to put the first slide back up? I just didn't get all the notes.
You don't have to get the notes. It's a matter of common sense, dear. Yeah.
Okay, and what does that say, the third arrow for the capillary transport what blood?
It's responsible for transport between blood and the tissues or organ. Okay. Part of the capillaries in your kidney, your glomerulus, and okay, yes, the peritubular capillaries. Okay. Did that make sense? So
Yes.
whatever blood is being supplied to an organ, it's going to be as okay when it runs in capillaries. When that blood runs in the capillaries, that you're going to have okay transport between substances in the blood and the tissues or the cells that makes up the tissues, that makes up the glands and organs. And likewise in the opposite direction as well. Okay. So at the level capillary, that's okay. Things may leave the blood and enter into the cells and tissues. Likewise, okay, substances may leave the cells and tissues and enter into the blood. So this transport of substances from blood to tissues and from tissues to the blood, that happens at the level of the capillaries. Okay. So here you can say it's okay. All this here is okay, was your water supply. Whereas all this here is okay, was your water drainage. But when you take the supply and the drainage and put it together, it becomes that's okay, the circulation of water. Yeah, okay. So water circulation of the blood is going to include both arterial supply and venous drainage. Now, guys, one thing that I've been doing for years and years and years and years and years is mainly as okay, giving all my students as okay a comparison between arteries or artery and veins. Or vein. Okay. Now you may find some of these points that's okay here in the book. Okay. But what I would like you guys to do is just okay, write them down as we go on. Okay. Now, first point, and pretty much okay, we can say it's okay. The only point that both arteries and veins have in common is that they are blood vessels. We can mainly say, okay, when you talk about arteries versus veins, this is probably as okay, the only main thing that they have in common. So if I ask any of you as, okay, can you tell me anything about an artery or a vein? Well, at the least you should be able to say, well, okay, it's a blood vessel. Okay, whether it's you ask about an artery or a vein. Okay. Now, what remaining can say about all arteries. What remaining can say about all arteries is that, okay, we can say that these are the, now I'm just going to just, okay, abbreviate blood vessels as BV. So these are the blood vessels that we can say it's okay, carry blood from the heart to an organ or to the organs. Okay, so all arteries in your, okay, in your body, okay, what they primarily are going to is okay be responsible for is mainly as okay taking that blood that came from the heart and supply it to the organs. Did you guys get that? Whereas when we talk about the veins, now these are the blood vessels that carry blood. Now here it's going to be as okay an opposite direction from the organs to the heart. Did you guys get that? Okay. So all veins ultimately as okay, what would they be responsible for? Taking blood from an organ and carry it back towards the heart. So this was what all arteries will do. This will be as okay what all veins will do. Now we can with surety say that most arteries, and there's a reason that I use the word most. Now most arteries will carry or supply blood that is, now I may use a technical term here, which is going to be oxygenated. Now, what does it mean to be oxygenated? We can mainly say, okay, rich in oxygen. Okay. So most arteries mainly as okay is going to carry blood that is going to be as okay what we can call oxygenated or rich in oxygen. Now, guys, the reason that I use the word most is because that there is an exception. And that's going to be except from the blood vessel that we call the pulmonary artery. Now we know that pulmonary is okay is pertaining to lung. Artery is going to be as okay, just like any other artery that carries blood from the heart. In this case, yes, okay, to the lung. Okay, but why is that an exception of okay, yes, carrying oxygenated blood? Because this is going to be as okay, a blood vessel that carries blood from the heart to the lung, mainly so that that blood can get loaded with oxygen. Okay, so what your pulmonary artery actually is going to do is going to, okay, which carries or supplies what we can call deoxygenated blood. Okay, and what does it mean to be deoxygenated? We can mean it as, okay, if one was rich, then there is going to be, it's okay, poor in oxygen. Okay. If you guys don't want to use the word rich or poor, you can say it's okay, high in oxygen and low in oxygen. Either one is correct. Okay, but technically speaking, yes, okay, blood is going to be low in oxygen, is going to be referred to as being deoxygenated. Blood that is going to be rich in oxygen and high in oxygen is going to be called oxygenated blood. Most arteries carries blood that is rich in oxygen or oxygenated. The only artery which is going to be an exception here is going to be the pulmonary artery. Okay, an exception in what terms? Yes, okay, because it's going to be the only artery in your body that carries poor oxygenated blood or deoxygenated blood. Okay, but the pulmonary artery does what every other artery in the body would do, carry blood from the heart to the organ. In this case, it's okay, the organ is the lung, mainly so that the blood can get reloaded with oxygen that happens in the lungs. Okay. And the same, but just opposite applies to your veins. So you can mainly say, okay, the same, that most veins, okay, it's okay, that will carry blood that is deoxygenated, which means it's okay, going to be either low or poor in oxygen. Okay. But again, it's okay, since we use the word most, that's because, okay, there's going to be, it's okay, that exception. And that's going to be, it's okay, for the pulmonary vein. Okay. Now, the pulmonary vein is called a pulmonary vein. I was going to call a vein mainly because it does do what every other vein in the body would do, carry blood from an organ back to the heart. Okay, but this was me as, okay, blood, which when it came to the lungs was low in oxygen. What happens in the lung is going to be loaded with oxygen. Okay, but then be carried as, okay, via pulmonary vein back to the heart. Okay, so the pulmonary vein is mainly as, okay, going to, as, okay, carry blood which is oxygenated, or what we actually call rich in oxygen. Did you guys get that? Yeah, okay. Now, guys, this is going to be a game of bullying one another, because arteries have something which the vein won't have. And the vein, and that's okay, on the other hand, will have something which the arteries don't have. Okay, so what we can say is that yes, okay, arteries have pulse. Okay, so arteries, yes, okay, they will have a pulse. So what you guys will be learning is okay, in your next module is okay, how to feel different pulses in different areas of the body. But keep in mind that okay, yes, those pulses, if you're able to feel them, mainly mean that okay, as your finger is on top of an artery, that means yes, okay, just taps against your finger. Okay, so that's something that you only will find in a artery. Only arteries will have a pulse. Now, veins do not have a pulse. Now, veins do not have a pulse, but they got something that an artery doesn't have. And what that is going to be that. Okay, so what does a vein have? That's mean it's okay going to even out the score here. So you can say the veins have valves. Yeah, okay. Did you guys get that? So the artery is like, hey, I got a pulse. And the vein will say, yes, but I got valves. Okay. Now, some of you may say, it's okay, valves, isn't that what we found in the heart? Didn't we have valves in the heart? Good. Okay. Now, your question may be, so why do we need veins, valves in the veins? Well, okay, in just a little bit, yes, okay, when we talk about, yes, okay, the structure of arteries compared to veins. Okay. You mainly see that, okay, yes, the blood flow in the veins is going to be, yes, okay. You guess it's okay. With a lower strength due to, yes, okay, a thinner vessel wall in the veins. So mainly that's okay to ensure that blood flows back towards the heart, or to ensure that's okay, what we can call is okay, blood flow in one direction, or prevent backflow of blood in the veins. They need valves. Okay, great. So the function of the veins, the valves in the veins is the same as the function of the valves in the heart. Did you guys get that? Okay. Now, you actually, when you go and start, yes, okay, scanning blood vessels, and you capture veins, you may be able to see the veins going like this. They're pretty small, but it's okay. You may be able to just okay catch the valves in the veins, and it's a beautiful view to look at. Okay, okay. Now you don't need to remember this. Just as okay for your own interest, because okay, whenever we talk about a valve, yes, okay, it could have XYZ number of flaps. Clear? Okay. So the valves in your veins got two cusps or two flaps. So there will be bicuspid valves. But please do not, when you see a valve in the vein, say, oh, I see the bicuspid valve or I see the mitral valve in the vein. Okay? Okay? But yes, okay, structurally, yes, okay, what do they have? Mainly, yes, okay, just two flaps that opens and close, opens and close, opens and close. Okay, but just remember the yes, valves or veins. That's okay. They have valves. Okay, and we can just say it's okay, and we can say it's okay. They would be bicuspid, which mainly means that they have two cusps or flaps. So if you look at a vein and you look at a valve, 1, 2. Okay. But please do not call this valve here the bicuspid valve. Oh, yes, okay, it's okay. Okay, then it's going to be as okay. The mitral valve. That's not okay. We just call it bicuspid because it got two cusps or flaps. Did you guys get that? Anything on this slide that you still want to, yes, okay, confirm? Everybody good?
Yeah.
Then we can just continue. Artery and vein, yes, okay, versus veins. Now, what we mainly can say is okay about the artery is that they have a thick wall. And due to that, and they have a small lumen. Now, guys, if we just look at an artery, in a cross section, okay. In all this, we can say that this here, that's going to be the wall of the artery, which is going to be thick. Okay. Which mainly means that, okay, yes, in the midst of all this central passage is what you call lumen. So the lumen is mainly as okay, L-U-M-E-N. It's mainly as okay, just another word for is okay, the passage through which yes, okay, a substance pass. Okay, so when you look at an artery, okay, it's going to have okay as a relatively thick wall, and okay as a small lumen. Okay. Whereas, my dear guys, on the other hand, when we look upon the vein, it's just going to be the exact opposite. So what can we say the veins have? Yes, okay, they have a thin wall. Okay, and they have a big lumen. Okay, so if we say a vein, that just says, okay, that's a vein of the same size as that of our artery. Okay, But what we see that the vein have is going to be as okay, 10 more. Okay. And since it has a thin wall, yes, okay, it will have a big lumen. So all this is okay in the middle of the wall, or in the center of all of the wall is going to be as okay, your lumen. So you can say it's okay. If you look at it, you can say it's okay, the artery, that's the donut. And okay, the vein is an onion ring. Did you guys get that? Okay. And pretty much, okay, yes, due to this thick wall here. Okay. Or let's say it's okay, the small lumen. That's going to mean the cause that, okay, as blood flows through this artery, the artery will expand. Clear? Okay. And that expansion, that's mainly as okay, what you are going to feel as a pulse. Did you guys get that? Okay. So that could be as okay, one of the main, yes, okay, you can say it's okay. Structural explanations of the artery that explain why the artery has a pulse. Yeah. Okay. Whereas it's okay if you look at okay, the vein now it has a thin wall. So it will not be able to just okay apply that great amount of force onto the blood. Okay, as it flows through it, and that's why it's okay, it will need the assistance of valves to push the blood ahead. Did you guys get that? Okay. Now, guys, another thing. So when we take, okay, as we says, okay, an artery which and a vein is okay, which has pretty much the same size, that's okay. This is going to be as okay, the difference between the two. Now, another thing about the arteries. Now, mainly speaking, as okay, when we compare about arteries and veins, we can mainly say, okay, that there's only going to be one set of arteries. Okay. And relatively, as okay, what the arteries are going to be is okay. And they are deep. Where, guys, when we look at the veins, there's mainly not going to be one set of vein, but there's going to be, as okay, two sets of veins. Now, one of these sets here is okay, is going to be deep. We can say it's okay. And since they are deep, yes, okay, they run side by side to the arteries. Okay. The only difference about yes, okay, the arteries and the veins is the direction in which the blood flow. Okay, and this deep set of veins, generally, yes, okay, can be referred to as vena comitatus. Did you guys get that? Okay. So generally, it's okay that deep set of veins, I mean, it's okay, run side by the arteries, mainly we refer to as vena comitatus. But you can say, it's okay, you had a pulmonary artery, you have pulmonary veins. Okay. You can say, it's okay, you have gastric arteries, you have gastric veins, things like that. So that's going to be as okay, one set of veins, which means it's okay, run deep side by side to the arteries. The only difference is that, okay, yes, that the direction of flow of blood is in opposite directions. The other set of veins that we may come across, and generally, as okay, we may as okay talk about these in yes, okay, in the extremities or in the limbs. But that's going to be as okay what we call the superficial veins. Okay, especially as okay in your upper extremity, for instance. Okay, when you go and for instance, okay, to get blood work taken. Okay, now primarily as okay, they will try to obtain a blood specimen from your vein. That's why they are called phlebotomists. Okay, but then the question is, which set of vein is it that they're going for? The superficial veins. Did that make sense? Okay, so mainly it's okay when we talk of the superficial veins, we are mainly going to refer to as okay the superficial veins in the arms and legs. Is that clear? Okay. And when we get to that point of okay, talking about okay, the venous drainage of the legs, the venous drainage of the upper extremity, etc., etc. We will actually okay talk about okay how these two systems communicate with one another. Okay. Okay. But in arteries, we mainly as okay have arteries which mean are going to be relatively deep. So only one set. Any questions so far? So is any of this here making any sense?
Yeah, so
Okay.
far.
Good. So just remember, artery is donut, vein is onion ring. One set of arteries, and these are going to be relatively deep. Two set of veins, deep, side by the arteries. Those deep veins can generally be referred to as vena comitatus. But then it's okay, we have a superficial set of veins. Most likely, it's okay, we'll talk about those in the extremities or in your limbs. And guys, please, okay, this here is not going to be as okay supplied to you in a note. So please just okay, try to write down as we continue. Okay. Okay, guys. What's the next thing that we can say? arteries compared to vein. Arteries mean they're going to be high pressure blood vessels. Or let's put it this way. High blood pressure blood vessels. Whereas veins mean they're going to be as okay, low blood pressure blood vessels. Now, what would that mean? Meaning that, okay, yes, if you measure the blood pressure in an artery in any area of the body, what would you get? A relatively high blood pressure reading versus, yes, okay, if in the same areas, okay, you measure the blood pressure in a vein, that is going to be low. Okay, now usually, yes, okay, now usually, when we talk of, okay, measuring a blood pressure of a person, we actually, yes, okay, are measuring, yes, okay, the pressure in the artery. Okay, and saying, okay, well, your blood pressure is 160 over 90 or something like that. Okay. Okay. But okay, in the same areas, okay, we are to measure the pressure in the vein. That's going to be as okay, a relatively low blood pressure, low pressure. And that's pretty much okay, yes, due to the structure. Okay, that's pretty much okay due to the structure because here, as the blood flow through the artery, what it means is okay, we'll be doing is pushing and applying a great pressure up against the vessel wall. And that's what you call, yes, okay, that's what's going to be recorded as the blood pressure. As here, it's okay, due to, yes, okay, a greater area, the blood will not be applying that much pressure onto the wall of the vein. And that's going to cause that, okay, in the veins, the blood pressure is low. Ultimately, guys, we can say that okay, arteries divides into smaller branches called arterioles. Okay. And these arterioles then, yes, okay, further divide into, yes, okay, what we call the capillaries. Okay. Whereas, guys, when we talk of the veins, now veins are formed by the union of smaller veins. That we call venules. And we can say, it's okay, these venules are formed by the union of capillaries. Now, if we look at it, and if we want just okay, draw that here, we can say, yes, okay, we have an artery. Okay. Now, what this artery here is going to do is going to just okay give off smaller branches that we call arterioles. And what is it that these arterioles here ultimately are going to give is each arteriole is going to give off yes, an extensive network of small blood vessels that we call capillaries. Did that make sense? But on the other hand, we can say as okay, these capillaries will then okay as reunite mainly as okay to form smaller veins. That we call venules. And these venules will reunite to form what we call a vein. Did you guys get that? Yes, guys.
Yeah.
Good. Probably yes, okay. We can say it's okay. The last point, which are artery versus vein. We can say all arteries. By as okay, we just take this as okay, except from the pulmonary artery. Okay. Directly or indirectly arise of aorta. And of course, guys, okay, as we start talking about okay, the blood supply or arterial supply of different structures and so on, so on, so you will see as okay what I mean by as okay, directly or indirectly. Okay, because it's not going to be every artery that's going to just okay directly branch off your aorta. For instance, okay, the artery that supplies okay is your hand, your forearm. Okay, they are not going to directly as okay branch off the aorta. Okay, I mean it's okay with branches that at one point as okay came off the aorta. So that's why it's okay I use the word directly or indirectly. Okay. And here is okay, the pulmonary artery is okay. It's not going to arise off the aorta because pulmonary artery arises from the right ventricle or the right side of the circulation of the heart. Okay. Now veins. Now we can just on the other hand say, okay, they're all veins. But of course, that's okay again, it's okay here, except from, it's okay, the pulmonary vein. Now again, it's okay, well, directly or indirectly. It's okay. Vein into. Now here is okay, it's not just going to be one blood vessel, but rather two. Superior vena cava or inferior vena cava. Okay. And besides these two vena cavas here, okay, there's going to be okay, a last venous circulation that we actually okay, we'll call the portal hepatic veins. But guys, as we will see, yes, okay, this portal hepatic veins ultimately, yes, okay, will empty into the inferior vena cava.
Does that say portal hepatic like in liver? As in
Portal
the
hepatic, yes, exactly.
okay.
Okay. So that means that's okay, tells you that's okay where this is going to be going to first before ending up in the inferior vena cava. Portal POTL. Okay. Portal. Oh, sorry. We can see branches directly or indirectly off. Okay, fine. Aorta. Now, guys, this was the first 101 of angiology. Right? So you can say it's okay, pretty compact, but still detailed comparison between arteries versus veins. And okay, yes, to begin with, yes, okay, even yes, okay, some differences in some arteries versus other arteries, and some veins versus other veins. Okay. Any questions? Anybody want to say anything? Nobody has anything to say?
I had a quick question.
Yo,
Yesterday we didn't receive the notes from yesterday that you said you would send.
no,
So,
I never said about yesterday, my dear. Why would I?
oh, you said Friday that you were doing it for the whole
No,
week.
no, 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 no. Well, okay, my dear.
Maybe there was a mistake.
Now, guys, before we continue, any questions? No, nothing. Okay, guys. Now, if you say an artery, and even if you said a vein, okay, we can say that, okay, yes, these blood vessels, or these blood vessels is walls are made up of three layers. I mean, it's okay, go from outer, which is going to be, it's okay, what we'll call tunica adventitia. So it says, okay, the vessel on the blood vessel wall, the outermost layer is going to be what you call tunica adventitia. Middle layer is going to be referred to as tunica media, which means it's okay, just means middle. And the innermost layer. It's okay. It's okay. And yes, it's okay, the innermost layer is going to be called tunica intima.
Sorry, is that an N or an M? Intima or?
It's INTIME. Okay. So just think of intimate. And ladies and gentlemen, inside there will be, it's okay, the lumen which has either oxygen-rich blood if it was an artery, or it may have oxygen poor blood if it was a vein.
You said that's the lumen in the
Exactly.
complete center?
Inside. Okay. Okay. But yes, okay. If we check any blood vessel, whether that's an artery or a vein, even if he says, okay, from an artery, yes, okay, we add arteriole. Even yes, okay, we said, okay, in the vein, yes, okay, was going to be, yes, okay, renewed. And okay, yes, if you look at it, it's going to have an outer layer, which is going to be, yes, okay, what we call the tunica adventitia. There's going to be a middle layer, which is going to be what you call in the blood vessel, we're referred to as the tunica media. And innermost layer is going to be as okay, tunica intima. Did you guys get that? Okay. Now a couple of things. Right? Because what we mean, you can say that okay, as your tunica adventitia is going to be made of, it's made as okay, going to be membrane. Okay. Of course, that's okay, since it's on the outside, it's going to be so okay, a little bit tougher, stronger membrane. Whether it was an artery, or whether it was a vein, or whether it was an arteriole, or whether it was an avenue, the tunica media is going to be as okay, the main layer of your blood vessel, which mainly as okay is going to be made up of the muscles. Okay. And what I've been saying, maybe not from day one, but it's okay, all of your internal organs or structures, if they had any muscle in them, that would be smooth muscle, except from the heart. Okay. So what main is okay is going to make up, yes, okay, the main bulk of your tunica media is going to be the smooth muscles that you have in the wall of your blood vessel. Okay. And it's actually, yes, okay, now since they are muscle, what do they tend to do? Contract and relax. Or mainly because, yes, okay, that they have the ability to contract. That's mainly going to cause that the passage in the blood vessel actually is going to narrow down. So as a contraction of these muscles here, so okay, what the vessel actually will do is constrict. And that constriction of any blood vessel is generally what we refer to as vasoconstriction. Did that make sense? Okay. So primarily, okay, in a blood vessel, what is going to cause vasoconstriction is when those muscles in the vessel wall contract. Did I make any sense at all? Or did you just understand the words that came out of my mouth?
So the contraction is the vasoconstriction.
No,
Or
what the
causes
contraction of these muscles here is going to lead to is vasoconstriction. And relaxation of these muscles here is mainly okay, going to lead to what we call vasodilatation, because the vessels are not going to open up or dilate. Did that make
So-
sense? Yes. Okay,
So
go ahead,
if
Ken.
they're involuntary contraction, what is causing the contraction? The blood
Well,
flow?
okay, okay, my dear, it's involuntary in the sense that, okay, you don't have a direct control on it.
Yeah.
Okay. The thing that causes is, okay, that contraction or relaxation and or is going to be as okay, you can say it's okay, the demands of your body. Okay. This contraction and relaxation primarily as okay is intended to occur to maintain the homeostasis. What was homeostasis? That ideal environment. Okay. Yep. Okay. But yes, okay, it's involuntary because you do not have direct control on that. You can't tell your arteries, okay, you know what, buddy, contract, body, relax. No. Okay. That's mean that's okay going to be your general body's functions that's going to, yes, okay, you can say dictate or regulate that.
Sorry, you said contraction leads to vasoconstriction and relaxation leads to what?
Vasodilatation. It's made or mean opening up. Listen, guys. Because what is that these muscles are going to be? It's okay, going to be okay arranged in a circular pattern in the vessel wall. Clear? Okay. Or just take a focus, you have a rope and you tie a knot. Okay. Okay. Now don't do this experiment at home. Okay. But as okay, you put that rope around as okay somebody's neck and you pull. What's going to happen? That ring is going to as okay constrict around that person's neck. Clear? Okay. Where okay, you says okay, if I let it go, what may happen? That ring is okay, will relax. So they're saying is okay, when that happens in vessels, that the muscles in the vessel walls, when they contract, they cause the lumen of the blood vessel to narrow down. Okay, what do we call that narrowing down of the lumen of a blood vessel? That's what we refer to as vasoconstriction. Generally, whether it's an artery or whether it is a vein. Narrowing down of the lumen of a blood vessel is going to be called vasoconstriction. Vaso from vessel, constriction, narrowing down. Or the mechanism of narrowing down. Okay. Whereas on the other hand, when those muscles relax, that's going to cause that the lumen of your blood vessel is going to open up. Mainly because the pressure around the lumen is relaxed. And you can say, okay, that opening up or dilatation of your blood vessels is going to what we call vasodilatation. So constriction is strangling. Relaxation is dilatation. Did you guys get that? Okay. Now, next point is tunica intima. Where is that going to be? That's just going to, yes, okay, again, be, yes, okay, a thin membrane. Did you guys get that? Now, guys, I may ask you, do you see some similarity between this and something else? Yes or no? This arrangement here and something else. Yes, Jennifer, you are unmute now, so you may speak out.
Is it like, oh, the outer meatus, inner meatus? No. Okay.
You outer what and inner what?
The outer meatus, middle meatus? No.
What is outer medius and middle medius?
Meatus, meatus.
Now, okay, meatus is just another word for opening.
Oh,
Oh, shit.
sorry.
That's okay.
I tried.
The heart muscles?
Hard. Vicky, you are exempted from the final. What percentage do you want?
I'll take 100 if you don't mind.
Okay.
Yeah.
Just come in and I dictate you the answers and you just write them in your own writing, okay?
I have to come in for that? Can we do it online?
No, because it has to be you writing, my dear.
All right. I'll be there.
Okay, good. Hard. Guys, why are you? I don't know. Okay. Because what did we have in the heart? Or myocardium to be more accurate. The answer is yes. And then, okay, yes, if the answer is yes, then the next question will be, is okay, where? Epicardium, right? Myocardium, right? And adiocardium, right? So we can mainly say, okay, where does this tunica adventitia come from? It may as okay just be as okay a continuation of the epicardium. Where does the tunica intima come from? It may just be as okay a continuation of okay as the endocardium. Although as okay in the heart we can only have as okay myocardium. But you may say okay in between as okay two layers of membranes. We had in the vessel we had the muscles. In the heart we had the myocardium. Did you guys get that? Now, another thing, guys. And I think I even said that before. But we can mainly say, if I didn't, well, okay, here it is. Whatever blood flows through the chambers of the heart. Whatever blood was flowing through the chambers of the heart. The heart didn't get any benefit from that. Okay, it was not like, okay, as blood flowing as okay through any chamber of the heart, that oxygen, goodies, nutrients, etc., that the myocardium may need for its contraction was going to be delivered to that chamber as the blood was flowing through the chamber. Right? Okay. And that's why the heart had its own blood supply that we call the coronary circulation. Right? Because that's okay. The wall or the bulk of the heart was made up of muscles. Muscle needs oxygen. Primarily, it will need, primarily, that's okay, that's okay, glucose as a source of energy. That was going to be supplied to the myocardium through the coronary circulation, right? Good. And when looking on the heart, where did we find the coronary circulation? Between which layers?
Between the myocardium and the endocardium? No. Between the myocardium and the epicardium. No, the
Okay,
endocardium.
Okay,
Final.
so which one is it, my dear? You said
Between
both.
between the endocardium and the myocardium.
Pardon me?
Between the endocardium and the myocardium.
Okay, so that's where you think the coronary circulation is going to be running.
Yeah.
Okay, good. Asma, I was about to exempt the person who answered. I was going to get exempted from the final. But you will have to take the final twice because your answer was wrong. It runs between, listen, my dear, your coronary circulation runs between the epicardium and myocardium. Okay, what runs between your endocardium and myocardium is going to be the conduction pathway. You remember the conduction pathway? Yes, my dear. Do you remember the conduction pathway?
Yes.
Do you mind name the sequence of the components of the conduction pathway?
It starts from the left atrium, or the pulmonary vein going up to the left atrium into the left ventricle, well, through the bicuspid valve into the left ventricle. Am I way off because you're looking at me crazy? I
Yes,
haven't
my dear,
reviewed
you
all of
are
them.
way off.
I haven't reviewed all
What's
of
the
them.
conduction pathway? Anybody want to tell us what the conduction pathway is? The pathway or the system through which the electrical signal flows.
Oh,
Oh,
the AV,
the
SA
SA.
node.
what you're trying to explain was blood flow through the heart. Okay, once you see the word conduction, that's going to mean flow of electricity. Good.
All coming back now.
So that conduction system, that was going to be between the endocardium and myocardium, but between your epicardium and myocardium, we had the coronary vessels, or the coronary arteries, okay, which means they were responsible to supply oxygen goodies to the myocardium. Did you guys get that? Did you guys get that?
Yeah.
Good. Because, yes, okay, a lot of things are just copy and paste. Okay. Now, what was the myocardium? That was a muscle. Okay. What did that muscle need to do? Contract and relax. Why? So that blood could be pumped from one chamber to another, from a chamber to the blood vessels, and be pushed into the circulation. In between, yes, okay, contractions, what is it that the chamber would need to do? Relax. Clear? Okay. Likewise, your blood vessels. The walls of these blood vessels, what were they made of mainly? What was the main layer of the muscles? What was the main layer of your blood vessels? So we can mean says, okay, yeah, that's where we have the, what we call the coronary arteries. Okay. Which means, okay, I was going to supply the myocardium. Okay. Now, guys, in the blood vessels, the tunica media is the major layer of your blood vessel, which means, okay, makes the biggest of the bulk of your blood vessels. Now, guys, just look at it in the same way, because, okay, blood that flow through this blood vessel here. Well, you can say, okay, the structures of your blood vessel is not going to benefit from any of that. Just like blood flowing through is okay, the heart. The myocardium was okay, the structure of the heart was not going to, as okay, receive any goodies, nutrients, exactly from that. Did you get that? Okay, so what does that mean? That will mainly mean that, okay, yes, your blood vessels will have their own blood vessels, which is going to just, okay, supply oxygen, nutrients, exactly, to the structures of this blood vessel here. Okay, and what is that we're going to call those blood vessels? Vasa, mainly from vessel. Vasorium. So vasa, vasorum, what are they? Blood vessels that supply blood to the blood vessels. Now, can anybody guess where these vasa vasorum are going to be? Yeah.
Between the outer and middle layer.
Okay. What do you call the outer layer, my dear?
The I can't say it.
You have to.
The I don't know how you spell it. How did you spell this? Adventitia?
Adventitia, exactly. Very good. Okay. So you
And-
knew it.
Yes. And then the middle layer, which is
Okay. Which is called?
tunica intima. No, that's the, I'm sorry, it's the tunica media.
Media, exactly. So here. Or we can mainly say, okay, here. Okay. So your vasa vasorum mainly is, okay, a blood vessel that supplies the blood vessels. Okay, and where are they going to be found? Between tunica adventitia and tunica media. So it's like, okay, the coronary arteries, which will mean supplying blood to the myocardium, or running between epicardium and myocardium. Now, in 23 years from now, when one of you are sitting in the hot chair on Who Wants to Be a Millionaire and call me and say, okay, Mike, it's $1 million question. I may say, Vicky, that's okay. I may have given you, that's okay, 100 on the final because I wrote out all the answers to you. Well, right now, I'm senile dement or suffering from some pretty bad, it's okay, biology 101 amnesia. So I may not be able to help you. You call the wrong friend. Okay. So, that's okay. It's pretty much okay. Just copy and paste if you want to put it that way. Now, some of you say, okay, why tunica, tunica, tunica? Does anybody know what a tunica means? Okay. Does somebody know what a tunic means? Because it means, okay, just come from tunic.
Isn't it like a shirt?
Okay.
Is it like a layer?
Literally means sleeve. Just like, okay, yes, the sleeve on your shirt. Or you can say, okay, your shirt. But literally, it's okay, it just means sleeve. So that's okay. If I was to, yes, okay, wear a sweater on this, that becomes, okay, an outer layer. If I was going to wear a jacket on top of that, that was going to be a third layer. So, okay. Yes, Asma. Did you recall what the components of the conduction pathway was? In order.
The essay note, the AV note, the bundle of His, the bundle branches, and the Purkinje fibers.
Here we go. Good.
I have a question.
No. Yes,
That
go ahead.
the picture you drew with the lumen in the middle. So
Yeah.
I know the artery has a small lumen and the
Yeah.
vein has a big lumen,
Mhm.
but you drew one lumen, like in
Well,
the
okay.
middle.
It's for the same. Okay. Okay. Now you can maybe say, okay, why the arteries have a bigger or smaller lumen? Was because they had a thicker wall. Okay. Why do they have a thicker wall? Because there's going to be more muscles in the wall of the artery compared to that of the veins. Yeah, okay. Okay. But the lumen, that's made as, okay, what you will call as, okay, the passage in an artery, in a vein, in an airway, in a gut, in a urethra, even as, okay, things as, okay, your bladder. The central part is, okay, of your bladder, we're going to store urine, which will be as, okay, literally be the lumen. Okay. So that passageway through is, okay, any body passage, through is, okay, a substance will pass is going to, is, okay, you can call it a passage, or more as, okay, politically correct, or the actual correct term will be lumen. Did that make sense? So you can even say it's, okay, lumen of the gut. What's going to be in the lumen of the gut? Well, okay, as whatever you ate, whatever is left of it, right? Okay. Okay, so it's going to, okay, pass through the lumen. Okay, the lumen of your airways. What's going to be the lumen of your airways? Here, going in and out. Okay, so that central path or passage through which says, okay, substance will pass through this, okay, is going to what you call a lumen. Okay. What literally makes us, okay, the lumen of a vein bigger than that of the artery is because the vein had a thinner wall. So relatively, it's okay, less muscular than an artery. Yeah, okay. And it's pretty much okay due to, yes, okay, that muscle is okay being pushed up against, is okay, that we feel a pulse in the expansion. All your arteries then are going to expand as blood flows through it. And that is what is felt as a pulse. Okay, dear. Well, that's okay here. What I mean is okay. Here. What this means is okay, well, okay, this could be a lumen of an artery. This could be a lumen of a vein. If you said this was an artery, yes, okay, this would be an artery. You can still say, yes, okay, it's still good. If it was a vein, well, okay, it would be a vein. Okay. Even if it says, okay, arteriole. You know what I mean? It's okay, just a branch that was going to just, okay, branch off from this artery. Or even if it's a venule, which was just going to be, okay, a smaller vein that will join with other venules to form a vein. Did you guys get that? Okay. So what we had in an artery were all three layers: outer layer, tunica adventitia; inner layer, or middle layer, tunica media, which was made of the muscles; and the inner layer, which was, okay, as a thin membrane known as the tunica intima. In the heart was, okay, we had similar structures: epicardium, myocardium, endocardium. Now, ladies and gentlemen, as we said, it's okay, we had artery that branch into arterioles. Arterioles is just going to just, okay, mean smaller arteries, just like bronchioles are just small bronchi. Yeah, okay. But then we said that these were going to just, okay, divide into just, okay, what we call capillaries. Whereas, okay, at the other end, we say, okay, these capillaries were mainly, okay, just unite to become, you can say, okay, venules. And venules mainly, okay, will form or unite to become veins. Now, earlier this morning, I said that the capillaries, now as far as the function was concerned, are blood vessels. And why I say that is mainly because, okay, they do the same job as any blood vessel would do, which is because they transport blood. But on the other hand, I also said that, okay, although it's okay, Functionally, we can still consider them as blood vessels, but structurally, as fine as long as their structure is concerned, they may not be considered as blood vessels. And the reason for that is, guys, the capillaries have no tunica adventitia. And tunica media. But only are made up of tunica intima. So we said in arteries, we had tunica adventitia. We also had, for instance, okay, tunica media. And tunica intima. This is okay, continues in the arterioles. Yeah, okay. We even see the same as okay sequence or pattern of things or layers in venules and veins. But once you go from SOK, we can say okay, terminal arterioles and capillaries. We are only going to have tunica intima. So these two outer layers, tunica adventitia and tunica media, terminates or stops in the capillary network. Okay. And since that's okay, the capillaries main is okay, that's what made up of this thin membrane here. That's why we can say, okay, that main is okay, enables things to just okay, leave the bloodstream into the tissues at the capillary levels, as I said. And likewise, okay, substance is okay, be transported from the tissues into the capillaries. Did you guys get that? Okay, so mainly because okay, your capillaries do not have a tunica adventitia and tunica media. That's why we may say that okay, structurally speaking, well, okay, they don't have the necessary components that's going to just okay make it a blood vessel structurally. But functionally, yes, okay, still do what every other blood vessel will do. To yes, okay, transport blood. Whether that was in the arteries or whether that was in the veins. Yeah, okay. In all circulations in the body, I mean, yes, okay, it just happens is that, okay, yes, as blood flow through organs, it's going to become less and less and less oxygenated and more deoxygenated. Do you guys get that? Any questions?
This one.
One? Okay.
Yeah.
Is this the last one?
Yeah. Well,
Okay.
maybe.
Okay.
Okay.
Go ahead, dear. Go ahead.
No, I was just confirming. Do capillaries transport blood from the artery or vein, or they transport blood between the artery and vein?
You can mainly say between arteries and veins is going to be as okay, the capillaries.
Okay.
Yeah, okay. But what happens at the capillaries, that's going to mainly be as okay, goodies that was brought to that organ or structure through the arterial blood will be delivered. And yes, okay, waste products that those cells want to get rid of is going to be as okay, getting from cells into blood. So those exchanges between, yes, okay, substances in the blood and substances in the cell is going to, yes, okay, that exchange of those is going to happen at the capillary levels. It doesn't really matter which organ, tissue, structure you're talking about. But if you want to say, okay, yes, between arteries and veins, you have a network of microscopic blood vessels called capillaries. Actually, so small that you won't be able to, yes, okay, see them, right? Okay. You're not going to be scanning a patient. Oh, okay, I can see a capillary, I know. Okay, okay. They are super duper microscopic. Any other words or any other questions? Yes, Dennis, you have a question here? You just look like you were about to say something, but maybe you swallowed it. You good?
Yeah, I'm good. I have a
Okay,
quick
okay,
question.
okay. Just want to confirm that. C. Okay, guys. Now, let's just talk about the main artery in the body. And what do we call this fellow here? Now we can say it's okay, that arises off the left ventricle in the heart. Now he is called the aorta. Okay, so that's going to be okay, one of our main topics for now.
I'm so sorry. What does it say? The body that something off the left
The
ventricle?
main artery in the body that arises off the left ventricle in the heart. What do you call that?
The aorta. Thank you.
Aorta. Okay. Now, guys, if we say, let's do it this way. Okay. We can say we have a heart. Oh, let's make it a little bit higher. Because we may need something. Okay. We can say we have a heart. And what mainly is okay will arise off from the left ventricle. It's going to be this massive fellow, blood vessel. Known as aorta. Any questions? Now, guys, at some point, not at some point, they say aorta main, yes, okay, gotta pass through, yes, okay. It's opening in the diaphragm. This opening here is going to be referred to as the aortic foramen. So roughly speaking, we can mainly say that, okay, yes, the aorta has two parts. There's going to be, yes, okay, what we'll call the abdominal aorta. Yeah. Okay. And we can see that, okay, yes, where all this is going to be, let's just choose a new color. We can mean it's like all this is going to be the thoracic aorta. Yeah, okay. So structurally, yes, okay, it's going to be one blood vessel that arises from the left ventricle of the heart. Okay. From the aortic valve. Runs in the thorax. That part of the is going to be referred to as the thoracic aorta. It passes through as okay, an opening in the diaphragm called the aortic foramen. After which, yes, okay, physically it's still going to be aorta that continues in the abdomen and is going to be referred to as the abdominal aorta. Okay. Ultimately, now we can say, okay, at the level of L4. Now, what's L4 going to be? That's going to be, okay, your fourth lumbar vertebra. What's going to happen to your aorta? It's going to split or branch off into two branches. So we can actually say, okay, that will be, as okay, what we refer to as the bifurcation of aorta. But the word bifurcation is, okay, we'll come across that term again and again, which means, okay, which means, okay, that, okay, yes, any artery, in this case, is, okay, the aorta, splits into two. Yeah, okay. And what these two blood vessels, that's okay, will be called. Okay. Now, because it's okay, going to be the right and left. So there's going to be a right and a left, and they go under the same name. The only thing that's different is the sides. Okay. So they will be referred to as the right and left common iliac arteries. Artery. Or you can say, so you have a right common iliac artery and you have a left common iliac artery. Okay. But why, how did these right and left iliac arteries arise? Pretty much, okay, by the ending of the abdominal aorta, because it splits or it bifurcates and become two branches called, respectively, right common iliac artery and left common iliac artery. Did you guys get that? Okay. Where does this bifurcation of the aorta happens? At the level of L4. Was it that L4 meant? Main, yes, okay, just represented the fourth lumbar vertebra. Okay. And other anatomical landmark that mainly is okay, well, landmark, yes, okay. Because, okay, on the surface of a person's body, you may not be able to physically say, okay, this is going to be, it's okay, where the four lumbar vertebra is. Okay. So this can actually, as okay, that's okay, this point of L4 actually is going to be, we can okay, add the, let's say, it's okay, point where we have the umbilicus or belly button. So if you take a person's abdomen and you say, boop, this is where his or her belly button is, that's going to be the point where you actually will see that your abdominal aorta bifurcates into two. Branches, respectively, being the right common iliac artery and the left common iliac artery. Yeah. Did you guys get that? Yes, guys. Okay. Or if you say, yes, okay, if you do it this way and say that, okay, yes, if this is where it's okay, your umbilicus was, and you mean it's okay, just draw a straight line back. Posterior is okay, that line is going to cross through L4, which was your 4 lumbar vertebra. Okay. What happens at this point? Yes, okay. You can make it okay where your abdominal aorta is okay, will bifurcate. And she's okay, a right common iliac artery. And okay, it's a left common iliac artery. By cheated, it's okay, or then cheated abdominal wall, yes, okay, it's going to mark by your belly button, or umbilicus. Posterior is okay by L4. Okay, now what happens to you is okay, these common iliac arteries, so on and so on and so. We will talk more of that when we talk the blood supply of the legs. Okay, so we come back to that one again at that point. By this point, any questions, guys? Okay, guys. This was the simple part of the aorta. Oops. So here we go. Now we come in, yes, okay, just see. Let's remake this fella here. So the heart. Oh, let's bring it up a little. The heart. Well, okay. In the heart, we have the left ventricle. Okay. Off the left ventricle is okay. We have the aortic valve. And off the aortic valve is okay. Arises the aorta. It goes like this until it passes through the aortic foramen in the diaphragm. But this is mainly going to be as okay, your thoracic aorta. So all this here is going to be your thoracic aorta. Now, guys, your thoracic aorta is going to be divided into 3 parts. The first part is called the ascending aorta. And mainly, it's okay if you look at it, if this was your left ventricle, it's called the ascending aorta mainly because it rises up. It moves up. Yeah. Okay. Other part of the aorta, and I mean, yes, okay, going to go off here. Of your thoracic aorta is going to be, yes, okay, what we call a descending aorta. Did you guys get that? Yes, ladies and the gentlemen.
Yes.
Did you guys get that?
Yes.
Good. Now, guys. Let's use this color. Because this point here. Or even as okay, we go straight back. This point here. Now, guys, if you guys recalled when we talked the sternum, I said that okay, yes, if we talk the sternum, we had the main body of the sternum, right? Then we had something that we refer to as the manubrium of the sternum. And what did we have between, or what did we call the point where the manubrium of the sternum meets the body of the sternum? What did we call that part?
The jugular notch?
Huh?
Is it the jugular notch?
Nope.
The angle of Louis.
Angle of Louis. Or we also could call it, okay, the sternal angle. And what did I say? Yes, okay, why was this an important structure? Because on each side of this was going to be your second rib. Clear? Okay. Oh, let's do it this way. We had the manubrium. We have, okay, that's what we call the sternal angle or angle of Louis. And then we have, okay, as the body of the sternum. Okay. And where we said that, okay, as was going to attach to each, as okay, attached to the sternum at the angle of Louis on both sides was going to be the second rib. Coming from the right, coming from the left. But what I said at that point, and this is why I said it, that okay, is if we drew a line going straight back, like this was going to just, okay, cross at your level of G4. And this line here, guys, is made as, okay, what I just drew here for the heart. Or more correctly speaking, for the aorta. So in all this, guys, you can say, okay, this is going to be as, okay, where your heart is. The part of the aorta that goes all the way as, okay, to the level as, okay, of the angle of Louis. Or where, okay, your second ribs are going to be attached, will be the ascending aorta. Now, that line going back, straight back towards this, okay, it's going to cross at the level of G4. But that is also going to, we can say, okay, the beginning part of, okay, as well becomes the descending aorta. And what we actually is, okay, have in between these two, it's going to be this part of the aorta here, which is just going to be called, now you can call it the arch of aorta. Or if you want to, yes, okay, you can also refer to as the aortic arch. Both terms are correct. So that's how your aortic arch is going to go. Okay. So where does your aortic arch start? Anteriorly is okay at your angle of Louis or sternal angle. But where is it that it's going to finish? Posteriorly at the same level, but that will be at thoracic vertebra G4. After which it means, okay, just continues as your descending aorta. Clear? Okay. So ascending aorta was called ascending aorta because it goes up. We have the arch of the aorta main, that's okay because it arches. And then you would have the descending aorta. Did you guys get that? So it was not just for fun that I talked about the different parts of the bone of the manubrium. Oh, sorry, sternum, sorry. There was a reason behind all that craziness. Clear? Okay. Now, guys, what many people, yes, okay, or what you may perceive if you look at a diagram of the aortic arch, or arch of the aorta is, if this was the heart, we can say, okay, we have the ascending aorta, and then the arch goes like this. So many people may perceive it as, okay, it goes from the right side onto the left. That's not really correct. Actually, it's okay, what is going to happen is, okay, if this was the front of the heart, and okay, what's here is going to be the back of the heart. Ascending aorta, then the arch of aorta, well, okay, it slides a little bit, okay, from the right side onto the left, but mainly runs from front to back. Did that make sense? So it's going to arch like this. So it runs from front to back, which means you call that, okay, the descending aorta is going to run posterior to the heart. Did that make sense? Okay. So mainly it's going to just, okay, form an arch that runs from front to the back, but still slightly as, okay, from right onto the left, but mainly arches from front to the back. So the descending part of your aorta is going to be behind the heart. Did you guys get that? Now, ladies and gentlemen, any questions? Any questions?
And it remains posterior as it continues to run all the way.
Exactly. Yeah, okay. Even my idea is, okay, when it goes into abdomen, okay, that aortic foramen is going to be, okay, pretty much, okay, back, or it's okay, posteriorly on the diaphragm. Because even as, okay, as it enters into the abdomen, it's going to, it's okay, as I said, back, then, that the major blood vessels in your abdomen were retroperitoneal. Okay, what did I mean by the major blood vessels back then? Primarily, as okay, your aorta and your inferior vena cava. Okay, so even as okay in the abdomen, the aorta is going to be all the way as okay up against, as okay, this is your spine running down like okay, pretty much okay, anterior to the spine, but still be retroperitoneal. Clear? Did that make sense there?
Yes, thank you.
Okay. And in the abdomen, that's okay, more on the left, or that's okay, pretty much okay, running on the left side of your spine. Inferior vena cava is going to be on the right side. So just two less okay, we can say okay, main lanes of the highway. One running southbound, one running northbound. Eastbound, westbound. Right? Unless okay, you have one of those, what do you call the people that okay has run on the wrong side of the road? You know there's 100% death if you're one of those. If you're going northbound on the southbound direction, what is going to happen?
Bound to crash.
Crash.
Crash. Okay. What's going to be the outcome of that?
Possibly death. Or you're
No,
gonna-
not possibly. You will be the EAD. As a matter of fact, I think it's okay. 4 people died this weekend, not far from our school in Stratford on the 95. So, because they probably is okay, merge onto the highway on the wrong side. So,
There's been a lot of those lately.
yeah. Whereas people just forgot how to read signs, or I don't know.
Either that or it's really confusing at the intersections.
Well, yes, okay, then you shouldn't. If you're confused, then okay, don't take the highway. It's better to just okay get into okay, not better, but because the outcome is going to be less fatal. Yes, okay, if you get into an accident on a side street rather than okay as on a highway where everybody is going as okay 70, 80, 90 miles an hour. Unless there's somebody here. Let me see. Somebody else, okay, they may even be going faster than that. Yeah. That's okay. People who scratch their head or smile, it's okay. So, yeah, that's me. That's me. Okay, the 121. Yes, okay. That's me. Okay. Okay, guys. So for me, that's okay. Just two blood vessels carrying blood, but just in opposite directions. Aorta mania is okay, will take blood that was coming from the heart. I mean, it's okay, now it's going to be responsible to give up branches that were supplied to organs. Clear? Okay. Inferior vena cava, mainly it's okay, is going to just okay. Take blood from organs or receive blood that came back from organs and take it to the heart. So mainly it's okay, traffic of blood just flowing in opposite directions. From heart to organ and from organs to heart. Did you guys get that? Good. Any questions? So what's going to the point at which we can say that, okay, yes, the arch of aortic arch starts at the level of the sternal angle or angle of Louis. Okay, how may we identify that? Well, okay, as either by okay, locating the angle of Louis, or you can say, okay, locating your second rib. Okay, but a straight line going from angle of Louis, tick, 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 from the front to the back. At the back is going to cross across T4. What was T4? Fourth thoracic vertebra. Okay, so that will be just okay, the point at which it's okay, your arch ends, aortic arch ends, and what is coming is okay, or what is the continuation of your aorta at that point and beyond is going to be the descending aorta. Did you guys get that? C. Any questions? Any question, ladies or the gentlemen?
So the heart it's on the left side of the angle of Louis, right?
No.
Like it's
Nope. 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 Listen to you. Okay. Let's say if this here is okay, is your sternum. And we can say it's okay here. We have the angle of Louis. Here, okay. Now we can say it's okay that maybe it's okay a mid-sagittal line that goes right in the middle like this. Oh, my dear, if this is your heart, 1/3 is going to be on the right. 2/3 on the left. Okay. And we can mainly say yes, okay. Aorta comes like this. Then we say it's okay, we have the arch. And main is okay, may go slightly like this, but main is okay posteriorly. And then we just have this okay. Descending out. So you can't say that, okay, the heart is on the left side of the sternum. No. A mid-sagittal line, that means, okay, going to divide the sternum into an equal half, right and left. But it's okay, that mid-sagittal line means, yes, okay, also marks, well, okay, 1/3 of the heart is going to be on the right side of that. The remaining 2/3 is going to be on the left side. And oh yes, okay, this is a Valentine's Day heart. Literally, yes, okay, the heart is going to more be like, okay, let's see. Structure, let's okay, like this to be more correct. Let's say this will be the apex. So this is 1/3, this is 2/3. Okay. And TV is okay, we can say it's okay. This was marked by as okay, angle of Louis. But posteriorly, at the same level here, it's okay, that's going to also mark G4. It's a straight line. Or you slice somebody up at the angle of Louis, or okay, in the front is okay, you may cut through angle of Louis, posterior is okay, right through G4. Did that make sense?
Yes, I think I was confused because the other picture, you didn't draw like the halves like of the heart, so I looked at it differently.
For me, it's okay. Most of the heart is on the left than the right. Okay. Okay, guys. Now, just before sending you guys on Blackbrook, what we mainly can say is okay, will be as okay, the major branches of your aorta, ascending aorta, is going to be the coronary vessels, or let's say it's okay, coronary arteries. Okay. Is there anybody who still don't get the coronary arteries? No, if you mean to see this here, the left vertical, we have the aortic valve, from which it's okay, the aorta arises. And we call this part of the aorta the ascending aorta. Of which we're going to have, yes, okay, two main coronary arteries. The right main coronary artery, no, sorry, left. Sorry. Left main coronary artery and the right main coronary artery. So let's just start with the right main coronary artery. Will give off two branches. Now we say that, okay, yes, this is the right main coronary artery. It's going to just, okay, run like this. It will give off two branches. One is going to just, okay, what we'll call the marginal artery. Running down like this. Other branch. The actually is okay is going to circle around and actually is okay run on the back side of the heart. The back. So that's mainly because okay, it runs onto the back side is going to be referred to as the posterior. And ultimately, as okay, will be artery. Now it can have as okay two different middle names. Some people will call it the descending. Mainly as okay because if you look at it, it descends down. Some people may also call it the posterior. Interventricular artery. Because you meaning it says okay on the back side means okay going to run in between the right and left ventricle. All right. Did you guys get that? Now on the other hand, we can say it's okay that we have the left main coronary artery. This dude here. Or we can make him a little bit long. Although yes, okay, this may not be as okay that clearly visible because it means okay that there's going to be as okay that it means it's a flap of the issuer left atrium that comes on top of it. But just to mark it, well, okay, we can say it's okay, it runs like this. We're going to just okay, so actually your left main coronary artery. And this will give off two branches. That's one. Okay, choose. let's say, one is going to be as okay what we call the circumflex artery. The reason that we call it a circumflex is because it's going to okay circle around the lateral side of this okay the left ventricle. Okay, and posterior is okay may is okay give branches that runs like this. But mainly is okay. What we will be doing is okay as give off an artery that runs down along the lateral wall of the left ventricle. Okay. Other branch of the right main, left main coronary artery is going to be as okay what we call the anterior. And okay, his last name is going to be artery. Which is going to be as okay like its posterior counterpart. Have two middle names. Either what could be as okay descending artery, because what it will do is branch off the left main coronary artery like this and run down. And mainly it's okay because the cerebellum okay runs in the anterior groove between the right and left ventricle. It can still be referred to as being the interventricular artery, but on the anterior side. Did you guys get that? Okay, so as far as your ascending artery, ascending aorta is concerned, that's pretty much okay as whatever gives rise to your coronary arteries, which are mainly right main coronary artery and left main coronary artery. The right main coronary artery gives off the marginal artery, and the posterior descending artery or the posterior interventricular artery. Whereas, okay, is your left artery or left main coronary artery gives off the circumflex artery and anterior descending or anterior interventricular artery. Okay. And this is pretty much okay as how it runs. Okay. Now, as far we can say it's okay, the blood supply of the posterior walls of your heart. Okay. Posterior side or posterior walls of your ventricles primarily. That's again is okay going to be an area is okay where there is okay maybe variations between where it's mainly supplied by circumflex or posterior descending. Okay. But that's all things that's okay that they is okay determine on angioplasty, so angiographs. Or coronary angiographs, as we call them. which of these two is primarily as okay responsible for supplying blood to as okay most of the posterior side of the ventricles. Sinka. Okay. Okay. Any questions, guys? Now, don't worry about the last point that I talked about, okay? Okay. Okay. So, but any questions about what I just talked about? Or your coronary circulation? So your main point would be what you need to know. What are the major branches of your right main coronary arteries? What are the main branches of your left main coronary arteries? Clear? Okay. And it's okay if you got a similar diagram to something like this, you'll be able to just okay label them. Capish or no capish?
Capiche.
How would you say to know in Arabic?
Um, I don't know. I know how to say it in like Egyptian dialect. Daraf.
Well, you can say it in your dialect, my dear.
Yeah.
There's no problem if we,
Daraf.
huh?
Daraf. Daraf.
Daraf, okay.
Daraf.
Then what is adraka?
Oh, to know.
Oh, okay, okay. Maybe I'm okay. Okay. Yes, here's a how you say in Punjabi. Understood?
To understand samaj.
Samaj?
Yeah.
आ रही है या जा रही है?
Yeah.
Okay. Is the understanding coming or going? It will be coming. Okay. Good. Okay, guys. Before I eat your lunch break, take it. And when we come back, okay, guys, we will be focusing on the arch of the aorta. Okay. A part of the aorta that we will come back to again and again, but I want to make sure that, okay, we understand it. Okay. So arch of the aorta. Super, mooper, duper important. So please make sure that you chew on your food before you degluttate it so that you don't choke on it. And somebody has to call 911 because you are choking on a piece of whatever. So I see you guys back at, should we say, 1:10. Is that a fair deal?
Sure.
Good. I give you guys enough time to chew on your food.
Thanks.
Okay, guys, welcome back. And does anybody have any questions?
No.
Okay. In the break, I just sent you guys an email. Did anybody not receive it? The subject will be something aorta. Okay, if anybody didn't get it, then just email me and I resend it to you. Okay. Okay, guys. Now let's just look at our arch of the aorta. Or as I said, yes, okay, can also be referred to as the aortic arch. So you say, yes, okay, then we have the heart, we had the ascending aorta, and after which we have the heart of aorta, which we also have called the aortic arch. Okay, now just to make us okay, the sides clear here. This would be the right side. This would be the left side. Okay, and our aortic arch. Mainly got 3 branches. The first one okay. First branch is going to be okay, what we call the brachiocephalic trunk. Just like the trunk of a car, okay? TRUNK. But the first branch of the arch of the aorta is going to be called the brachiocephalic trunk. Our second branch of the arch of the aorta is going to be the left common carotid artery. Okay, guys? And the third branch of your arch of the aorta is going to be the left subclavian artery. Now, some people may call the subclavian artery the subclavicular artery. Did you guys get that? Yes, guys.
Yes.
Did you guys get that?
Yeah.
Okay.
Yes.
So first branch, mainly as okay, we call, well, okay, we said the arch of the aorta slightly goes, okay, slightly as okay, it goes from right to left, but mainly as okay, also goes anterior to posterior. So the first is going to be as okay, or brachiocephalic trunk. Second is going to be the left common carotid artery. Third is going to be the left subclavian or left subclavicular artery. Either names are correct. Okay. Now, guys, one thing, when you see the word trunk, okay, whenever you see the word trunk, yes, okay, being used for a blood vessel. Point number one is that this termine is always going to, yes, okay, be used for an artery. So you will not see the word trunk being used referring to a blood vessel if it was a vein. Clear? Okay. Another thing that you guys need to remember about the trunk is that while the trunk mainly is okay, is used when an artery is going to give off multiple or some branches. Now, pretty much okay, the three occasions, yes, okay, where we use the word trunk. One is going to be, yes, okay, for the brachiocephalic trunk. Some people we also, okay, also refer as, okay, the main pulmonary artery to the pulmonary trunk, which mainly is, okay, just will give off the right pulmonary artery that goes to right lung. And it's okay, we can say the left pulmonary artery that goes off to the left lung. Okay. But some people, yes, okay, will refer as, okay, that first artery that, okay, as arises off from the right ventricle at the pulmonary valve, first as being, yes, okay, the pulmonary trunk. Okay. So yes, okay, brachiocephalic trunk, pulmonary trunk. And what we will see in the abdomen is going to be, yes, okay, something that we call the celiac trunk. And this dude here is, okay, may make some of you guys cry. Probably it's okay. We can say it's okay, the most complicated, not complicated, but it's okay, difficult. Although it's okay, very small branch of the aorta. But it's okay. But why? Mainly because it's okay, it's going to give off. In this case, it's okay, 3 branches. Now, ladies and gentlemen, when we talk about the brachiocephalic trunk, now if you look at it, it says, okay, the heart. Okay, well, we had the ascending aorta. We have our, oopsie, aortic arch. We have already said that, okay, it's off the aortic arch. That's okay. Last we're going to be left subclavian artery. Prior to that was a branch that we call the left common carotid artery. Okay. We said that we had, okay, yes, the brachiocephalic trunk. Now, if you look at the word brachiocephalic trunk, First word is brachial. Or brachy, which means okay, means arm. Okay. On the left side, as okay, or mainly as okay, started off as okay, the subclavian artery will become the axillary artery, will become the brachial artery. So your right or your brachiocephalic trunk mainly as okay is going to further give off two branches. One is going to be your right subclavian artery. Which ultimately is okay, will become as okay, your brachial artery. Just like okay, the left also is okay, become a brachial artery. And if you just look at the word cephalic, or C, which was cephalic, means head. So on the right side, what do we have? You have a right counterpart to your that common carotid, which is going to be a right common carotid. Did you guys get that? So you will have, okay, as a right and left subclavian artery. You will have a right and left common carotid artery. Okay. Now what mainly is okay happens to the subclavian artery on the right and left side as they run is going to be the same. Whatever happens to your right and left common carotid artery, further on their course is going to be as okay the same. But the only way in which is okay, the right common carotid differs from the left common carotid, and the right subclavian artery differs from the left subclavian artery, is first of all how they originate. Because the right common carotid and right subclavian branches off from the brachiocephalic trunk, which was a branch of the arch of the aorta. Whereas your left subclavian artery and left common carotid directly branch off the arch of the aorta. Did you guys get that? Okay. So what could be questions here? What is the first branch of your aorta? Arch of the aorta? What's the second branch? What's the third branch? Clear, okay? Yeah, okay. What's going to be as okay, the difference between the origin of the right subclavian versus left subclavian? Right common carotid versus left common carotid. Only the origin is different. What happens afterward is going to be the same whether it's on the right side or left side. It's going to be the same whether it's on the right side or left side. But the origin is different. Clear? Okay. Another thing that you can be asked is, how many brachiocephalic trunks do you have? And the answer for that is just one. Clear. Okay. And please remember that, okay, when we say trunk, there's no question about it. Trunk is always going to be a term that will refer to as a artery. Okay, but that term is made as reserved for primary as the three trunks that I gave you: pulmonary trunk, vagus-cephalic trunk, and what we later on will see to be the celiac trunk. Okay, all of these are arteries in one way or the other. Any questions? Okay, guys. So mainly as two major things that's going to be supplied off from the branches of the aorta that we will talk about is going to be Mr. Brain and your arms. Did you guys get that? Okay. Any questions? No. Did I make myself clear? Okay, ladies and gentlemen. If you guys got the major branches of our arch of the aorta, then we can mean yes, let's say, what about the descending aorta? Of course, at some point, it's the descending aorta is going to finish off. Now we can mainly say, not really as much of importance, but it's we say, the descending aorta. Mainly as as it runs will give off what we can call intercostal arteries. And what would they be? Mainly as there's arteries that runs in the intercostal space. Now, not necessarily as exactly in the intercostal space, because you can see we have a rib and we have a rib. Okay, so this space here would be your intercostal space. Okay, but if we look like this, well, let me just take this to the slide. So we can say, okay, if we do a cross section, and we say, okay, this is the rib. Now, just so you guys know, this is going to be the lateral side. If you look at the side of the rib, that's okay, from lateral side. But it's going to be the same as, okay, posterior and anterior. Right? There we can say, okay, this would be the medial side of a rib. So the rib mean, yes, okay, it's going to run something like this. And we can say, okay, we have a rib below. And now it's mainly going to be in this area here. And this area here, yes, okay, where we'll have what we can call as, okay, the neurovascular bundle. Now, when we say neuro, what is that going to be? That is going to be your nerves, intercostal nerves. When we say vascular, mainly as, okay, you have blood vessels. And what were your blood vessels? Well, okay, yes, you will have an artery. And of course, yes, okay, you will have a vein. Yeah, okay. There, okay. This space here is okay, will be is okay, intercostal space. Did you guys get that?
Quick question. That's
Yes.
so the descending artery is going to be
No,
going in.
not your descending artery. Your
okay.
descending aorta.
Oh, yes, the descending aorta is going to be going in that.
Nope,
But the
nope, nope. Your descending aorta is going to give off branches known as intercostal arteries.
okay.
Did that make sense?
Yes.
Good. Now, guys, if we look at it, okay, what we mainly have is, okay, we can say, okay, we have the, maybe we even have, yes, okay, our pleura. And deeper to the pleura, do we have the lung? Yeah, okay. Well, it's okay. In spite of all this, okay, we can even say it's okay that we may have. Well, it's okay, yeah. Pleural effusion that need to be drained. And that's why you mainly, as okay, we'll see when that is done, that whoever is doing it blindly, if they didn't call any of you, so yes, okay, hold the probe so yes, okay, that we can scan and make sure that okay, tip of the needle hits the pleura. They was me, yes, okay, that they're going to go around the top of the rib or top of the lower rib in the intercostal space. Now, why that? Mainly as okay to reduce the chance of hitting the neurovascular bundle. clear. You may say, okay, what if, okay, as the pleural effusion is all the way up to here, for instance? Or here is okay down here. Of course, then never go for okay, there's lower intercostal space here. But mainly it's okay, that's how it's done. Then the needle will be put in here to mainly as okay. Drain. Up against that's okay, the rib or the lower rib of the intercostal space through which you want to go and okay, as drain this pleural effusion. And why not anywhere up here? Because okay, there may be as okay a greater chance of hitting the neurovascular bundle. Did you guys get that? Okay, my dear. Other branches that the descending aorta will give off. Is going to be esophageal arteries. Okay. And why? That's okay. Pretty much okay. Yes. Closely related to yes, okay, the esophagus. No, sorry, to the aorta. It's going to be the esophagus. Yes, okay. From the aorta to the esophagus is going to be yes, okay, supplied of arteries. Did you guys get that? Now, guys, the last pair of arteries that we may is okay just mention as branches of the descending aorta is going to be as okay what we will call the superior rhenic arteries. Okay. Now, guys, when you see the word superior or an artery, for instance, that means okay going to should give you not okay. But what you should be prepared for is that there's going to be as okay an inferior artery going under the same knee. So inferior phrenic artery. But the reason that we call this one here the superior and okay as this other fellow here inferior is okay, yes. Because what does the word phrenic stand? It's mainly as okay a word that refers to the diaphragm. Okay. So the word phrenic mainly is okay. They'll be referring to the diaphragm. And that pretty much tells you as okay what this artery here is going to be doing. So the superior phrenic artery branches off your abdominal aorta, thoracic aorta, and supplies the diaphragm. Did you guys get that? Okay. So the word phrenic, always okay, it may be a little bit different, difficult, just okay, figure out, but just remember that, okay, that phrenic mainly is okay, is related to the diaphragm. Did you guys get that? Okay. So it's okay, some terminal branches of your descending aorta, which is me, is okay, the terminal part of your thoracic aorta is going to give off what we call the superior phrenic arteries. Superior, S-U-P-E-R-I-O-R, phrenic, P-H-R-E-N-I-C, phrenic, and an artery. Okay. And there used to be a nerve. Okay, it's still there. Phrenic nerve. Now, the other day somebody asked, what is the reason for hiccups? Well, okay, while you're awake, I don't know. It's still $1 million question. But I see as okay, people getting hiccups under surgery when we as okay were operating on the heart. And that was okay as that could become a pain, right? Because okay, well, there is a big nerve that runs and okay, as close to the heart that we call the phrenic nerve. And why do we call it a phrenic nerve? Because it's a nerve that's going to just okay send signals to the diaphragm. So I guess okay, that got stimulated or the patient was getting light on the anesthesia, and that's probably not going to be as okay a joy for either the surgeon or the patient if he or she wakes up in the middle of okay as an open heart surgery. Now, I want to see too. Okay. Okay. But usually we'll tell okay the patient is getting light, so the anesthesiologist or whatever you call him will just sedate the patient a little bit more. So yeah. Whereas okay, if the patient was getting hiccups, dum, 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 yes, the diaphragm will start okay, yes, dancing up and down. And I was trying to okay, operate on hard, yes, okay, bum, 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 yes, okay. Not fun. So your hands up, light the patient a little bit. Okay, guys. So how was today's class?
That was good.
Good. You guys liked it? Okay, there's a silence. Now silence can mean two things, right? Either silent is just like a silent yes, or maybe a silent would be, hell no, we're not going to say anything. Okay.
I did have a question.
Yes, my dear.
In the notes you sent, it mentions the ligamentum arteriosum.
Oh, don't worry about that.
Okay.
Yeah, because then it also talks about it's okay, ductus arteriosus. Now we can talk about that if you want to. Ductus arteriosus. Let's do that. What is ductus arteriosus? Now, guys, please remember when we were in our mother's wombs, all of us, we were not breathing. Clear? Okay. So what does that mean? That mainly means that, okay, as most of the right side of the heart, but okay, yes, it was physically there, or structurally, yes, okay, it was there because it was developing, right? But functionally, yes, okay, doing nothing. Because blood didn't need to go through our lungs for us to get oxygen. Who was breathing for us? Mama. Did that make sense? So in the intrauterine life, blood that circulate through, yes, okay, whatever was developed or under development, that came to the heart, will go from the right atrium to the left atrium. Did you guys get that? Okay, but not through a direct passage between right and left atrium or a direct hole, but rather from right atrium through the ductus arteriosus to left atrium, or from left atrium to left ventricle and into the circulation. Did that make sense? Now, guys, when we were born, that first cry or announcement of arrival of Junior, what did that do? Open up the lungs. Did that make sense? Okay. And pretty much, okay, at that part, that's okay. At that point, that's okay. That's when the baby now says, well, okay, if I can cry, I can breathe on my own. Okay. Now, what do you need from that point and beyond? That the blood now goes from right atrium to right ventricle, from right ventricle through the pulmonary arteries to the lungs. And then from pulmonary arteries, that's okay, or from the lungs, pulmonary vein back to the left ventricle atrium, left ventricle, and into the circulation. Did you guys get that? Okay, so by your lungs opening up, that's okay, that pulmonary circulation, as we call it, should be established or start functioning. And the idea is, okay, what will happen is, well, okay, we don't need the ductus arteriosus anymore. Because all of that means is, okay, also that, okay, blood could bypass the pulmonary circulation and go from right to left side of the heart. Did you guys get that? Okay, so ideally, yes, okay, what that should do or what that ductus arteriosus should do as the patient, as the fetus or newborn child takes his or her first breath, close. Did you get that, dear? Okay. Now, you may hear or you may have come across that, okay, they say, well, okay, well, the child still has a heart murmur. Okay. One of the common reasons for that is that ductus arteriosus, that we call it, didn't completely close. So there may be, as okay, some slight blood flow between the right atrium to the left atrium that bypasses that lung. circulation or pulmonary circulation. Did you guys get that? Okay. Now, as long as, okay, the pulmonary circulation is there, okay, it works, well, okay, no problem. People can live, okay, normal lives with what we can call as, okay, a patent ductus arteriosus. Patent just means, okay, it's still open. Probably not like as open as it used to be in the intrauterine life. But it's okay, it's still not completely closed. Did you guys get that? Okay. So this is one of you can say it's okay, because it's okay, one of the minor, well, I won't really call it defects, but it's okay in the flow of blood in children. There are some more as okay devastating as okay, which actually is okay will be as okay birth defects, which okay would need surgeries in the first year and a half or so of the person, where the poor child will have to undergo as okay at least 2-3 settings of open heart surgeries. Mean is okay first to construct something and okay as so. So that's okay. So, for instance, okay, a defect in your interventricular septum is not as easy to fix. Okay. Where you can still say, it's okay, well, okay, the deoxygenated blood is still going to mix along with the oxygenated blood. Well, it's okay, greater volumes of blood is going to remain deoxygenated if you have a defect in the interventricular septum than if you had, for instance, okay, a patent ductus arteriosus. So an adult people is okay, that means okay, this closes, and okay, ultimately it's okay, this become, it's okay. If it closes, ultimately it becomes just okay, strap of fibrous tissue. Which you guys says okay, will just be as okay, a ligament. Did that make any sense? So that's first cry, or cry of life. As we may call it, yes, okay. Does a lot of things. Yes, guys. So which blessing of the Lord can we be grateful for? Now, with that said, tomorrow, let me see what I have planned for you guys tomorrow. Oh, I written it down. So we did that. So guys, tomorrow we'll try to just okay talk about cow, circle of Willis. If anybody ever heard of that fellow. And talk a bit about yes, okay, the blood supply and venous drainage of the upper extremity.
I had a question before we ended.
Okay.
This isn't this chapter, but for the, okay, so does the prostate gland produce that alkaline, sorry, I know it's random, produce that
Now,
alkaline secretion?
Nope. That's going to be your bulbourethral gland.
Okay, it confused me because it said in the book that the prostate gland has that too.
It's going to be the bulbourethral gland.
Okay, thank you.
Prostate gland mainly is okay. You can say, well, it just stores. Well, okay, if you want to give it a function, mean, it'll be okay to store the sperm and semen, or semen along with the sperms before it can get, yes, okay, ejaculated. Okay, dear?
Thank you.
Okay, guys. So that's done. Any other questions? Okay, guys, then I guess I will see you guys tomorrow, same time, same place. With some other topics. Okay,
Have a good day. Thank
so
you.
do you guys. Have fun.
Thank you.
You're welcome, dear. Bye bye.